fits.
Today, the first day, we just took out his patch, so he's going to be kind of blurry at first. ¿Puede ver mi mano aquí, mi amor?
Sí, señora.
¿Cuántos deditos tengo acá?
5.
5. He can see my hand pretty well.
Before surgery, she was legally blind. She had less than 2400 vision in this eye. Even though she has a corneal opacity, she's going to have at least a 60 to 70% improvement in her vision. So that's going to make a big change. She's going to be able to do normal life.
In his case, it's really amazing because the first time he came and we did the first surgery, he told me, you know, I'm so happy because now I go back in my backyard and I can see the leaves, I can see the trees, I can see the lights. And he was so happy the first day.
Going from blind to being able to work again, to see at to look at her grandchildren's face again, to be able to read books again. As you're taking off the bandage from her face and you see the way she starts looking around, it's because she's rediscovering a new world. There's no other specialty like it.
And they come in here blind. They come in here being led by their family members. And then after their surgery, they're able to see, and they're able to become viable members of the society again. And they're just, it's so exciting. It's a miracle.
Hard case.
Oh yeah, this has been a hard case.
The idea is that we start with ophthalmology because ophthalmology, in the patient's minds all over the world, ophthalmology or eye care is the #1 felt need. It's also a center for this high-level training. So we're doing residency and subspecialty training in ophthalmology, and we're doing subspecialty training in orthopedic surgery right now.
I'm from Costa Rica. I'm in my 3rd year resident.
The idea was to create a residency training program, a program where we could also multiply ourselves. In the Dominican Republic, and this is the truth for most of the developing world, there are not enough eye doctors. So for example, there are 8.5 million people here. There are only 240 eye doctors. For example, Miami, they have 2.5 million people. They have 800 eye doctors. There are countries like Haiti, next door, where the situation is much worse. There are only 35 doctors there that can perform eye surgery for 8 million people.
I'm Haitian from Port-au-Prince. I was really trying to get into a school where I could do my training and then go back home to see what I could do for Haitian people.
And when I was in my country, you know, there's a big population that it's really poor and that they have a lot of problem in their eyes.
We only have 52 ophthalmologists in total for the entire country, which is a 7.5, almost 8 million people.
And 2 doctors who did his resident here, they went back to my country and they were the ones who started telling me about the excellent program that they have here in this hospital and the help they do to all these people. Descanse, corazón, hacia atrás. And when I heard about this program, I thought that it was a really good idea to come and do a specialty that right now it's really needed in my country because we have lots of people with cataract that they are considered blind.
Ever since I studied here, that's all we've been doing, working with the poor. We opened our eyes into how to stay in touch with what those persons feel a lot better than any other place.
And that's the reason why I came here and I chose this hospital because I want to make a difference in my country when I go back.
Our greatest asset probably is through the residency training program. There's permanence in it. We can multiply ourselves. We can reach any corner of the world that way.
One of the 80 medical teams dispersed around the globe by Medical Ministry International is arriving in Colombia. Their goal is not to provide short-term care, but to use the delivery of medical services as a vehicle to drive the development of long-term relationships and permanent improvement in medical care.
We're headed to a town called Buenaventura, which is on the coast of Colombia. This is the first time we're traveling to this country.
We have doctors, optometrists, opticians, nurses, technical people, and general helpers. And these people come from all over North America. This team is comprised of people who've been on upwards of 20 and 30 projects, and we also have some who are on their first project.
I can remember being on my very first project. I was a medical student at the time. This was back in the 70s. I was with my father, who was a doctor as well, and I was so impressed with cataract surgery and making people see that I thought, wow, this is for me. So that's how I ended up an ophthalmologist, as a matter of fact.
Many people will come on their first one thinking they'll try it out, but you really do get hooked on it because you end up feeling much more blessed for having participated in these people's lives. They're incredible. We learn much more, I think, than sometimes we feel we give.
The main pressure today is to establish our clinic in a way that's going to make it very functional, because how we get set up today will determine how the rest of the 2 weeks goes.
There's a struggle in this life we lead. It's partly you, it's partly me. But every road that's traveled teaches something new. And every road that's narrow pushes us to choose.
Our main operation in MMI historically has always been the 2-week mission. And that project has been of 2 general types. One is what we call general, and that includes medicine, dentistry, and surgery. And one that is ophthalmological and optical, and that's just eyes. In any given year, this 2-week project system will take place in 80 different sites in about 25, 26 different countries.
So the thing here is that there's such a huge volume of patients that need to be seen in this country that we have to have a system that is very different than what you're used to in North America. So what we have over here on this side is the registration area where we get the demographics on the patient.
This is the very beginning. We're just doing our history taking and registrations. These interpreters are listening to the problem in Spanish, and then they're going to write in English for the doctor on this history form. They're going to come in with cataract, pain, strabismus, glaucoma, and diabetes. Yes.
Over here on this side, what you can see is they're doing visual acuities on these patients. Now, checking the vision is the single most important test of visual function.
This E can be turned upside down, sideways, and we're asking the person with their hand to show the person at the next station which way is the E going. And the person over there will be standing 20 feet away, and the patient will show with their hand which direction the E is going, and we will get their vision acuity at 20 feet. If they can see this little tiny E, this little one, and tell me what direction at 20 feet, then they have 20/20 vision. If they can only see this one here at 20 feet, then they only have 21/20 vision. That's poor vision.
So that's what they're doing over here. Now, patients that get their vision checked over here, they move around this way into this other area in the clinic. And in this area, we have a lot of other stations where different things are happening. So the first things the patients do is that they're going to move down to room number 3 down here.
What we're doing in this room really is the initial medical screening.
Do they need glasses? Do they have some sort of pathology? Once they've been checked in number 3, then they move over to the next room where we actually have a machine in there that will test them for glasses.
This woman just came from screening, and the doctors send her into the autorefracting room here so that we can use this machine to tell how the light goes into her eye, and the way that it comes out in the bend will tell the doctor what kind of prescription she needs for glasses.
People that need glasses get their eyes checked by this machine, then they move over here to stations number 7 and 8, and that's where we actually give the glasses to them.
So these people are waiting to get some reading glasses, and then in the room behind me is a room that we brought with us, about 8,000 pair of prescription glasses.
This is where the people come with their history and the prescription of their glasses that they need.
And we're making use of 3 laptop computers in that room. The people there are entering the prescription that the doctors in the other stages of the clinic have written on that the patient requires.
And they find the correct prescription for that individual. There's about 8,000 pair here. They're donated by individuals. A lot come from funeral parlors, but hospitals, and from opticians who change glasses when people need a